That's what I'm really showing right here at day 0. That might be the first day that somebody is detectable by PCR. And then the antigen test might not catch somebody until the virus grows to 100,000 copies, or maybe even 1,000,000 copies. So that sounds like a big difference, 1,000 versus 1,000,000. But what's really important, and what is often lost when we think about limits of detection and sensitivity of a test, is what does it really mean, not from a molecular number, but from a time perspective. And this is really important in pandemic responses, time. And it's almost never considered when we think about the metrics of the test. And the reason is, if you look here at this graph, people will go from the limit of detection of a PCR test to hitting the limit of detection of a rapid antigen test that might be 100 or 1,000 times, require 100 or 1,000 times more virus, but that they might pass that threshold within just a day or hours from passing the limit of detection of the PCR. And that's because the virus at this point is growing so fast. It's exponentially replicating, it's doubling. And so it doesn't take long with exponential replication for something to go from 1,000 to 100,000 or 1,000,000. So within a day or so, you end up passing both thresholds. So you may worry if you're using a rapid antigen test that you're not getting high enough sensitivity, but the chances of even sticking the swab in your nose in between those two limits of detection is a very short window of time, let's say 15 hours or 24 hours. And then you're up here and both tests will be positive. At that point, both tests will be positive, and 99% of all the virus somebody has in their whole infection is going to exist in just a 2 to 4 day period of time. And that's when the virus is at its peak. That's when you're most infectious. An antigen test and a PCR test will both detect you at that period of time. A difference being a PCR test, if it has to go out to a lab, you won't get the result back for a day or 2 or 5, depending on what lab you're using.